going to be discussing the symptoms, testing, and treatment of Helicobacter pylori infections. And I chose this topic because it's one that I see commonly in my practice and people ask a lot. Helicobacter pylori or H. pylori is a bacteria that commonly causes chronic stomach infections. The vast majority of people have no symptoms or will not develop symptoms. However, about 10% of people will develop symptoms that may lead to the use of antibiotic treatment. Helicobacter pylori is capable of causing digestive problems, including ulcers, and much less commonly, stomach cancer. Helicobacter pylori is spread by consuming food or water that is contaminated with the organism, and then it goes into the stomach and duodenum. The duodenum is the first part of the small intestine. The bacteria infects the lining of the stomach, then that leads to toxin release, and then those factors may indirectly or directly injure the cells of the stomach and the duodenum. This causes chronic inflammation of the walls of the stomach and duodenum. As a result of these changes, the stomach and the duodenum are more vulnerable to damage from the digestive enzymes, such as the stomach acid. Most individuals with chronic gastritis or duodenitis are caused by Helicobacter pylori symptoms. Some of the symptoms that people may experience are pain or discomfort, usually in the upper abdomen, in the middle section of the upper abdomen. Bloating is a very common concern or complaint. Feeling full after eating a small amount of food, lack of appetite, nausea and or vomiting, dark or tar-colored stools, and if there are ulcers, they can bleed and cause iron deficiency, anemia. The diagnosis: there are several ways to diagnose Helicobacter pylori. There is a blood test that can detect specific antibodies, but this will not differentiate between, acute infection versus a past exposure or past infection. People can also get breath tests, which are very common. They are the Helicobacter urea breath tests. It's done in a provider's practice. It requires the person to drink a specialized solution that contains a substance that is broken down by the bacteria. Then the breakdown products can be detected in the person's breath, and it takes about 10 minutes and it's non-invasive. People can get stool tests, and that may happen when they are not able to get a breath test for whatever reason, or if there is suspicion that the bacteria could be elsewhere. So Helicobacter pylori infections can also be diagnosed by an endoscopy or an EGD. Should get tested anyone who has had chronic abdominal symptoms that are not getting better by a proton pump inhibitor, and they keep happening in spite of a workup that has been done and is not leading to anything else. Treatment: if the person has an active infection with Helicobacter pylori, they should get treated, and it's usually 3 to 4 medications that needs to be prescribed for 14 days. And it is important for that person to take the regimen correctly so that there is no emergence of resistance and treatment failure. Otherwise, the person may need to get retreated. This infection can be recurrent. It could come back after the person has been treated, and some people may need to be treated longer because they did not respond to the first antibiotic course. And usually the treatment includes 2 antibiotics and 1 proton pump inhibitor or an antacid. In some cases, 2 antibiotics and 2 antacids, including the proton pump inhibitor. If the person is not tolerating it well or does not respond, then they may need a longer course of antibiotics with different antibiotics. Common proton pump inhibitors could include omeprazole or pantoprazole, among others. And then common antibiotics that are used to treat Helicobacter infections include amoxicillin, metronidazole, clarithromycin, tetracyclines, among others. Some people may experience side effects while on antibiotic because they already have abdominal pain and abdominal symptoms. So if that happens, the antibiotic can be switched or other things could be added to help with that. But it is important to eradicate or eliminate the bacteria to prevent future problems such as stomach cancers. It is important to follow up. So after the person gets treated, about a month later, they should have a repeat urea breath test or a stool test to make sure that the bacteria is gone. If it is not gone or the person has recurrent symptoms, then they should be retreated. Thank you for listening. If you have any suggestions about topics, please feel free to include them in your comments. Also, like and share our page. Thank you.